You know that whole use it or lose it? That's real. That really happens. And so if you don't move that muscle, it's going to contract. It's going to stay short because that's all it's ever had to do. And that's why sometimes strengthening after a knee replacement takes longer, because you didn't have that range of motion before. If you had a knee and that knee was only bending to 70 degrees, then the quadriceps knew that it had to work from 70 to 0, and that's all the quadriceps had to do. And the hamstrings only pulled the knee back to 70 degrees. They didn't pull it back any further, right? So those muscle fibers that exist after 70 degrees on either side of the joint, they're on vacation. And they like being on vacation. And when you ask them to start working again, it takes a little bit of time for them to remember what their goal was, what their target was, what their job is. And so we see that being able to kind of miss that mark or miss that loss, because we can get that range of motion faster. We can get those muscle fibers to start firing a lot faster. And certainly in our patients that get to outpatient with the X10, who really were significantly limited in their range of motion prior, we're able to see that strengthening over that longer range happen faster. Because with the X10, we can focus specifically on this particular range and be very accurate with it because of how we can set the machine.